Let's talk about another common misdiagnosis when it comes to autism. My name is Dr. Ruth Dotton. I'm a board certified adult psychiatrist, and personality disorders are often misdiagnosed when it comes to autism. And this is due to a lot of overlapping symptoms, as well as the pervasive nature of these experiences. So today I'm going to talk about avoidant personality disorder because this is a common misdiagnosis. There is a lot of overlap with autism. Some of the symptoms that they have in common include things like social comparison, needing routines and structures, difficulty with eye contact, social withdrawal, sensitivity to feelings of rejection, and having difficulty with dealing with unknown situations. There's also a high occurrence of comorbid conditions like panic disorder, OCD, PTSD, anxiety disorders, and agoraphobia. In addition to these, there can be a high occurrence of EDs, substance use disorder, and self-harm. Scripting and rehearsing of social interactions can also be a common symptom, and of course, difficulty with social interactions. Now, while these two conditions can occur at the same time, that's not necessarily going to be the case. So let's talk about what might differentiate them. So with avoidant personality disorder, this usually arises from a sensitive temperament that's paired with early experiences of rejection. There's usually pervasive feelings of social ineptness, fear, and low self-esteem. In autism, it's more about difficulty with communicating and understanding neurotypical social cues, focusing on their special interests, the need for routine, and their sensory sensitivities. In avoidant personality disorder, people tend to socially isolate due to their feeling of social ineptness and low self-esteem and fear of being judged and criticized by others. In autism, isolation can be a healthy coping skill for dealing with sensory overload or just to recharge. With avoidant personality disorder, there's a desire to be social, but a fear of rejection and anxiety that's getting in the way. People with autism, in contrast, may be more content with being alone and just have less social motivation in general. They're happy to focus on their special interests and thoughts. And lastly, with avoidant personality disorder, there's a strong desire to be liked, a fear of being embarrassed, and low self-esteem. In contrast with autism, the stress comes more from issues of miscommunication, not understanding social cues, and just being overwhelmed in general from the social demands. So hopefully this helps you distinguish a little bit between avoidant personality disorder and autism. If you have any questions about this or personal experience, I'd love to hear about it. Wish you all good mental health today, and I'll see you in the next one.